Hi everyone, I'm Dr. Casey at Birmingham Health. This is one of my great patients, Miss Tina, and she's coming in with some different types of wrist complaints. Has it been on both sides, you said, or is it just mainly on one side?
It's both sides, but this one's worse.
Okay, how long has that been going on for?
Several years.
And what type of pain do you have in there?
Aches, pain, stiffness,
Okay.
and hard to move the joints, rotate it.
And when we do some work to it, what normally
It
happens?
loosens up and it feels better.
And you can do these activities better again?
Everything's better.
Good. So what I'm going to do is I'm going to walk you through some of the things that I check out each time. I know that the left or the right wrist is worse, but I'm going to check out the left wrist first. And one of the first things that we always check out to make sure the neurology of everything is working. So we want to make sure the joints are working right. Loose, 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 loose. Any pain or discomfort when we do that?
A little bit.
Okay. But right now, does that move a little better?
A lot better.
Good. So a lot of times when I have people that has carpal tunnel complaints, isn't really carpal tunnel syndrome. It's just the area where the nerve comes down into the carpal region. And we got to get that area to move better and do better by one, getting the bones and the nerves moving better and reacting better. But then a lot of times we see a lot of complaints be due to problems up here just below the elbow. So we also adjust the elbow because there's usually a dysfunction up there. And then we go through some of the soft tissue stuff. And so one of the main stretches I tell my patients to do is to keep the elbow straight, pull the fingers back, and they should feel a stretch kind of in the middle part of the forearm all the way up and down. And we hold that stretch for about 5 or 10 seconds. You kind of relax down and you just keep repeating it until you finally start feeling like things are calming down up here. It feels really good and stretched. And it's also going to help you down here because that's where the tendons of that muscle comes down and attaches to. The other thing that we also want to do is make sure that you have these muscles that come from just above the elbow that allow us to pronate and supinate. We got to work those out too. And so the other one that we try to do is find where that muscle might be tight, and it can be pretty sore sometimes. So if I get too much on there, let me know.
There it is.
And we're just going to try and again flex and extend the elbow, holding that pinpoint pressure down. I talked about this in one of my other videos. And then after you do that a few times, then we're going to start to go hand over hand while straightening the elbow, still holding that pinpoint down. We do that a few times, then we come over here, do the same thing, try to find where it's real tight. Oh yeah. So I'm barely putting any pressure on that area, and it's so sore to her too. So that means we really got to work that area out. You don't have to press down real hard, but just pin it down, straighten out the elbow, keep flexing and extending it, and then start going again, hand over hand. And as that begins to calm down, all these tissues up here, it's going to calm down the tissues over there. And people that have been told they have carpal tunnel syndrome may just have more of an overusage of these flexor muscles and an underusage of your extensor muscles. So that's how we kind of address some of our carpal tunnel patients in our clinic. And those are the same exercises that she'll need to do at home too. The more she does it, the better suspension there is, less problems down here. Sound good?
This is great.
Thank
Thank you.
Christina.